Good afternoon, everybody, and welcome to the Guide to Medicare webinar sponsored by Excellus BlueCross BlueShield. Thanks for waiting through that little delay there as I got things figured out on my end. We're so thankful that you're joining us this afternoon. Today, we will focus on the Medicare Advantage annual election period, which just opened up this week. And we'll better understand why it's so important for all of us to review our Medicare coverage each and every year. We'll cover some of those basics too. We understand this is a personal decision you may be making for yourself or maybe even for a loved one. And there's so much to understand. So for the next hour, we will hear from a team of Medicare experts, and they're going to help guide us through it all. They're going to help us make what could seem as an overwhelming amount of information feel okay. They're going to break it down for us and help us with all the acronyms too. Your questions add to the conversation for sure. So throughout this panel discussion, if you have a question, please just drop it in to the Q&A section. In addition, at the end of the main discussion with our experts, we'll give our panelists a chance to answer your questions, time permitting, and those that may be appeal especially to the entire audience. We really appreciate your experiences and your questions, so be sure to ask away. Just put them right up there in the Q&A. So let's go ahead and introduce our expert team now, the women who really know and who are going to share their expertise with us today. First off, we have, let me get this for you, we have Janine Myers. She's there on the left of your screen. Thanks so much, Janine, for being here. Janine, your job at Excellus BlueCross BlueShield is to educate people on the basics of Medicare and assist them in reviewing their Medicare options to determine what coverage might be the best for them. We really thank you for being here today and joining us with all of your expertise. Thanks, Janine. Next up, we have Amanda McLaughlin. She's an owner and licensed agent at I'm with Amanda Medicare Solutions. It's a private broker insurance agency specializing in Medicare. Now, Amanda, you work with the current Medicare members as well as those who might be approaching Medicare eligibility to determine if and when moving to Medicare makes the most sense, and you review what options that they might have that might be available to them. So thanks so much, Amanda, for joining us as well. And finally, Taylor Frawley is an aging specialist with Onondaga County Adult and Long-Term Care Services. Taylor, you oversee the Medicare counseling program for the county, among other advocacy programs for seniors, and we're so honored to have you here today, and Amanda and Janine. Thanks to all three of you for joining us today. Now, before we get started, there are some housekeeping issues. I get my glasses on for those. A few pieces of housekeeping before we go into the meat of our conversation today. We are recording this, so you can refer to it as reference. It will be sent out in a form of a thank you email and will be posted on syracuse.com in the coming days. And as we go through the webinar, if you have any questions, again, please just click on that Q&A icon on your screen to enter all your questions. Be sure to note that for everyone's privacy and to avoid any duplications, the questions will not be published, and our team will collect those, and our panelists will address as many of them as we can after their presentation. Also, we'll be addressing questions related to how Medicare works and the annual election period, but we won't be able to be covering details of specific plans available. So if you do have a question related to a specific Medicare plan, such as a provider's network and/or a specific benefit, well, just please reach out directly to your health plan or your licensed agent for those very particular questions. Appreciate that. All righty, let's get to it. Our first section focuses on how do you know if you have the right Medicare plan, the plan that's right for you. There's so much out there. To start us off, because I need a refresher every year, and I'm sure you do too, let's get some clarity with Taylor, our first guest today. Taylor, could you, before we go rock and rolling into the details, can you just tell us what is Medicare? Get down to the basics for us, please.
Yeah, thank you, Susan. Hi, everyone. Again, my name is Taylor. I work with Onondaga County Department of Adult and Long-Term Care. Medicare is such a broad term when you really look at all of the different options. When you first sign up for Medicare, when you're new to Medicare, everyone is signing up for Medicare Part A. Medicare Part A is your hospital coverage, and this is what covers your inpatient hospital services. I always remember Part A is admitted. Medicare Part A doesn't kick in unless you are admitted and inpatient at the hospital. It can cover some skilled nursing facility services such as short-term rehab following a hospital stay, hospice, and some home health care services through certified home health care agencies. And then there's Medicare Part B. Medicare Part B is your outpatient coverage. So this is your medical coverage for doctor's appointments, your preventative services, durable medical equipment. This is what most of us see with that standard Part B premium of the $174.10 that is going to be changing for 2025. And then there's the Medicare Part C. Medicare Part C is also known as Advantage plans. The Medicare Advantage plans will combine your Part A hospital, outpatient medical. They can include Part D prescription drug plan coverage, as well as some benefits towards dental, vision, and hearing. And then there's your standalone Part D. I remember Part D is your drug coverage that is added on with your original Medicare Part A and B.
All righty, that's great. Thanks for that, setting the table for us on that one, Taylor. Thank you. Now let's go over to you, Amanda, to get into some more of the depth of things. Where do you begin? How do you get started with Medicare? What if you have to enroll for the first time? There's a lot out there. How do we even begin this process?
Yeah, great question. Also, thank you for having me.
Sure.
So Medicare, traditional Medicare, original Medicare, that's really the Part A and Part B piece that Taylor just talked about. That's always the first step. Some people don't realize that if you're collecting Social Security income benefits at least 4 months before you turn 65, or the month that you turn 65, you'll be automatically enrolled in Medicare Part A and Part B. So if you're collecting Social Security, that card is just going to show up in the mail. I noticed a lot of times people miss it. It's a little oversized envelope, but it kind of looks like a lot of the other marketing mail and stuff that you're getting. So if you are collecting Social Security benefits as you approach your 65th birthday, keep a close eye on the mailbox so that you don't miss that card when it comes in. If you're not collecting in Social Security benefits, then you'd have to take an active step. So there's really 3 ways to do that. One would be visiting your Social Security Administration if they do in-person appointments. The other would be scheduling a phone appointment with your local Social Security office. The third way would be, and it's often the easiest, would be doing an online enrollment through your Medicare.gov website. So the same place that you go to check your income benefits, starting that 3 months before your birth month. When you log in there, if you scroll down, you'll see start a Medicare application. So it's either automatic if you're collecting or take an active step if you aren't through Social Security.
Okay, I have a question about the envelope where the card comes. If it's just coming, is it one of those plain white envelopes, or does it have some fancy stuff that we're going to recognize in the pile of mail?
It's a little bit bigger than a regular envelope, so that's one hint.
Okay.
And it's comes from Social Security Administration, Health and Human Services. It is a white envelope, but when you open it, you'll see in the very top right corner of that first page where you see your address at the bottom through the window. Your Medicare card is that flimsy piece of paper right in the top right corner. So it is easy to miss, but it is a little bit oversized, so it does stick out a little bit.
Okay, good information. Thanks so much, Amanda. Appreciate that. The details, the envelope details.
Yeah.
Right?
Yep.
Right. Okay, so then Janine, let's head over to you. Welcome. Once enrolled in an original Medicare Part A or Part B plan, and Part A and B, you have options available to get additional coverage. Can you tell us, Janine, a little bit more about the Part C plans and how they differ from the original Medicare that we just went through?
Yeah, so with Medicare Part C, which is commonly known as Medicare Advantage, your benefits will be bundled under a single plan from a private insurer like Excellus BlueCross BlueShield. Medicare Advantage plans usually go above and beyond the benefits and services of what's covered from parts A and B. And many come with extras like dental, vision, hearing, fitness plans, and most usually will come with your drug coverage as well.
So those are the add-ons, right?
Yes. Yep.
Okay, the add-ons, and I'm looking at the glasses. So like glasses are an add-on that I'd have to get
Yeah.
coverage for. Okay.
Yeah.
Okay, great. So back to Taylor. Taylor, are there other coverage options that we should be considering as we're in this sign-up phase?
Yeah, certainly. When you are considering different coverage, it's important to really weigh out what would work best on you. So, for example, if somebody's on original Medicare and they add on a Medigap supplement, Medigap supplement plans help to pay the out-of-pocket costs not covered by original Medicare, which is generally about 80%. With those Medigap supplement plans, again, they only cover the out-of-pocket costs related to Part A and B. They don't do anything with prescription drug coverage. Medigap supplement plans can be extremely helpful because they provide you coverage nationwide. So, it travels with you. And with those Advantage plans, you do continue to pay the Part B premium. You'll have an additional premium on top of that, depending which Medigap plan that you go through. There are several different options, and they don't come with coverage towards things like dental, vision, and hearing. But again, that's not a benefit that is all that important to everyone. So it's really about what works best for you in terms of choosing a Medigap.
Okay. And Medigap is the same as Medisup. I've heard that phrase too.
Yep, Medicare supplement, Medigap, it's an interchangeable term. So Medigap will pay secondary to Medicare. Whatever Medicare doesn't cover would then be billed to a Medigap supplement plan. And they are helpful because they help protect you from some of those surprise costs, help you just spell out what your premium is for the month and not having high bills or any bills depending on what plan you have afterwards.
All righty. What about this slide that we have in here? We're talking about Medicare Advantage only plans. Can you help further discuss that for us?
Yeah, great question. With the Medicare Advantage plans that don't include Part D drug coverage, that is an ideal plan for somebody who could potentially be receiving prescription drug coverage through other sources, such as the VA. There's a lot of veterans that might just be getting all of their prescriptions through the VA and they don't need prescription drug coverage through an Advantage plan or original Medicare. There also might be individuals who have credible coverage through a retirement plan. But the most important thing is, if you are choosing an Advantage plan, with no prescription drug coverage, make sure there is some other source of credible coverage for you so you don't face any penalty down the road.
Okay.
And then there's the dual special needs plans. Those are Medicare Advantage plans that essentially combine all of your coverage for those on Medicare and Medicaid, individuals with certain chronic or disabling conditions. And again, it is for those who are on programs such as Medicaid and meet the income requirements.
Okay, great. Thank you. There's a lot of information there. So glad this is being recorded so everyone can go back and refer to it. Yay. Alrighty. Thanks so much, Taylor. Now, Amanda, I think one of the panics or concerns for all of us when we move or when we're changing insurance plans is, how do I know that my doctor is going to be in that plan? So how does one choose a network and a doctor and kind of clear up that anxiety when we're dealing with Medicare?
Great question. So as Taylor just explained, so first with Medicare, when you use a supplement, your provider network would be any Medicare participating provider. So travels well throughout the country. When we get into the Medicare Advantage plans, we really want to make sure that we're paying attention to the provider network and how the type of Medicare Advantage plan that you have will work with both in and out of network services. So there's really three main types of Medicare Advantage plans. One is an HMO, which means health maintenance organization. This is really a managed care plan. So you'd be required to pick a primary care physician. And you really would need to use and see in-network doctors in order to have any coverage unless it's an emergency. So if it's not emergent services, not urgent care services, you'd really need to see in-network doctors with that HMO plan, or you wouldn't have coverage for that. A little bit more flexible is the HMO POS. POS stands for point of service. That gives HMO plans a little bit. It's usually an annual max amount that they'll contribute towards out-of-network services. Again, even with an HMO POS, you still could see, emergent and urgent care needs with anybody, but outside of that network, you'd be limited on how much the POS feature would provide. PPO plans, or preferred provider organization plans, tend to be the most flexible. Those plans will allow you to see any doctor that participates with Medicare as long as they agree to accept that plan. But seeing out-of-network doctors would cost more than if you saw in-network doctors, that preferred provider idea. That's why it's important to know your plan's provider network. Most plans do have tools that you could search, but that's definitely a great thing to rely on your broker to check for you. I have clients who like to double check, so they'll call the doctor's offices just to ask. But it's really important to find out, do I have an HMO? Do I have an HMO POS, or do I have a PPO? And we just talked a little bit about how those would function differently.
This all seems like my insurance currently pre-Medicare age, right? Because those acronyms make sense. I look on the website for my private provider. But so there, it sounds like even with Medicare, with the federal insurance, that there's a search engine really to find your providers.
There is, yeah.
So I get that. I get that. Something that makes sense there. I appreciate that. And I also always call the doctor's office directly too. So
just to make sure.
Just to make sure. That's just kind of how I'm wired.
You also can always, just another addition, you can always call the member services number on the back of your card as well. It doesn't hurt to check both options. So
yeah, wonderful. All the help is right there on that card. Great. Thanks so much, Amanda.
Sure.
Janine, how do we know? We talked about getting our, Amanda just talked about getting the right doctors, but what about the medicine I might be taking? How do we know the drugs are covered? Can you talk a little bit about that, please?
Yep. So you'll get your Part D through a private insurance company, either through a standalone plan or through a Medicare Advantage plan that has the Part D coverage built in. It's really important. Each plan will come with a formulary. And it's really important to make sure you reference that formulary with the drugs that, your prescription drugs that you're taking. These formularies will tell you what tier your drugs are in, so that way you can understand what the cost share will be. We'd always recommend that you sit down with your Medicare expert, bring your prescription drugs, and go through, and that way there's no surprises, and you'll know exactly what to expect in regards to what your drugs are going to cost above and beyond the premium, if there is a premium.
Okay. I mean, should I have a list of drugs I'm taking? I mean, is it really drug specific?
Yes, drugs is milligrams specific sometimes.
Wow.
So yes, it's very important to have the list, the full description of your drugs. So and your pharmacy, because you want to make sure that you're getting the best price. So you want to make sure that you're using a preferred pharmacy if possible to get those filled, so you get the better price on those.
So we have to have all of our ducks in a row before we make those calls. Okay, great. Thanks, Janine. This next section, we're going to talk about what's new in 2025, and there's a lot new. So really appreciate the experts being here today, because you're going to guide us through with all of these questions. Taylor, we're going to start with you. While we're on the topic of prescription drugs, as we were just talking about with Janine, can you, Taylor, tell us a little bit about the Part D changes that Medicare members can expect to see this year with the changes in 2025 upcoming?
Yeah, absolutely. Thank you.
Thanks.
So for the Part D changes for 2025, one of the biggest changes is that folks will no longer be having a coverage gap under their plan because of the out-of-pocket maximum of $2,000. So that $2,000 cap is going to help folks receive coverage who are, having higher costs. Once you hit that $2,000 cap on out-of-pocket medications, the plan will kick in full, and that coverage gap will be eliminated. And this is all due to the Inflation Reduction Act. So even if you look at the slides here, it goes through the different phases that folks will potentially be experiencing depending on their medications and their plan. So folks will have the deductible phase, and this is when you would pay 100% of the cost. And then once you're in that initial phase, the plan will pay 75% of the cost of the medications that are covered under that formulary. And then when you reach a catastrophic phase, this is when the member would pay nothing for the remainder of the calendar year. So it really is going to benefit everybody that is on a prescription drug plan under Medicare, and especially those who are having those higher costs.
So as a reference, that $2,000 cap, it used to be what, $5,000 last year, or what's the difference?
It was actually 8,000 this year, so you
8,000.
not dollar for dollar 8,000 out of pocket, but
Yeah, so quite
a
a
bit less.
yeah, quite a change there. Okay, great. Okay, thanks so much, Amanda and Taylor. Amanda, coming to you for the next question. How are Part B premiums changing for 2025? And again, the Part B are what?
Part B is the medical piece. That's what's currently deducted from Social Security if you're collecting it. If someone isn't collecting Social Security, I just want to note Medicare will bill that Part B premium cost through the mail. So you'll get a bill in the mail to pay. They typically do that quarterly. But we wish we knew what the Part B premium was going to be next year. So they haven't officially released it yet, but by all indications, what I've seen is $185. Please don't quote me because again, it hasn't been officially published. But we're expecting $185, which is up from $174.70 this year. I do like to point out too that some Medicare beneficiaries with higher incomes do pay more, which is called an income-related monthly adjustment amount, or an IRMA charge. Those start for individuals with adjusted gross incomes over $103,000, married couples over $206,000. And if you have one, you typically get a letter right around Thanksgiving, right? Happy holidays. We're going to charge you more, but they'll let you know exactly what that income-related adjustment will be. So we know Part B is going up. We think it's going to be $185. It hasn't been officially announced yet.
Do they know when it's going to be officially announced, or is it just
we never
sometime?
Really know.
Okay.
It's usually out by now.
Yeah.
We're already in that review period, but we don't know exactly what Medicare's premium or what their deductibles and copays will be yet. So stay tuned for that. Okay,
great. Thanks, Amanda. The next section is how to navigate this AEP, this annual election period. Super important to get all of your insight, all three of you, on the best way to go through the zigs and zags on this. Let's start with you, Janine, if you would. Remind what is AEP, because we have lots of acronyms in this space, of course. And then how long does it last? When does coverage begin? Could you give us some of those good bullet points for us, please?
Yep. So annual election period is AEP. It runs from October 15th through December 7th every year. And this is the time where Medicare members can evaluate their current coverage. They can make plan changes if they find that coverage isn't working for them anymore. If they do choose to make a plan change, that plan change would then take effect January 1st the following year.
Okay. So it's like our workbook time is happening right now. Figure out all the questions, but then it doesn't kick in until January 1. Okay. Okay. This is just a sidebar question for me. What are we looking at for changing? Should we be looking at if our health has changed or something? Why would we want to change something?
That would be one of the reasons. Maybe your drugs have changed. There's a lot of different reasons. Maybe you've lost a supplemental benefit on the plan. Maybe that's one of the changes in the plan that you have, and it was important to you. Maybe like something like dental or hearing, something got taken away or added to, or maybe there's another plan that has something richer that you want or like. So
okay, that makes sense. Thanks so much, Janine. Taylor, what's a good time to shop for a new plan, or why is this rather the best time to be shopping for a new plan?
Yeah, as Janine mentioned, this is the time of year that plans change. Most plans do change every single year, and folks will be receiving an annual notice of change packet in the mail from their current plan. It'll review with them what will be changing, compare what it is this year to what it will be next year. And it's just a good time to review your current needs and make sure what you are, the plan you're on still works for you. And just keeping in mind those changes within the plan's drug formularies, doctors, networks, all of those things can change, so can your health. So good time to review it and just take a couple minutes with whether it's the Office for Aging or an agent or whoever it is. Just review it so you make sure you have the best for next year.
Okay, good. Amanda, what if I choose the wrong plan, right? Like things are feeling good on October 15, 16, 17, but something happens or I realize that I really made a mistake here. Can you tell us a little bit about what happens if we made the wrong decision during this AEP time?
Sure. So if you enroll in a Medicare Advantage plan during this annual election period, Jeannie just explained that will start the first day of the new year, so January 1st. If you enroll in the plan and your coverage starts then, there is another option for you to change. So beginning January 1st through March 31st, if you're currently in a Medicare Advantage plan, you do have the flexibility under Medicare Advantage's open enrollment period to make adjustments to that coverage. Okay. You could also decide to leave Medicare Advantage during that open enrollment period and return back to original Medicare by adding standalone Part D, which is just the drug component. So you have a second chance.
You have a second chance. Is there an extra? Yeah, well, but if I wait or if I make a mistake and I have to change in that January, February, March window, is it going to cost me more? Is there a penalty like for not making the decision at the right time?
So the only potential, it wouldn't be a penalty. The only potential ramification might be, if you've already paid some towards your plan for January and it changes in February, you might incur new deductibles or something like that. But the plan isn't going to charge you an extra surcharge because you're making a change during that time period.
Okay, great. Thank you. Thanks, Amanda. Janine, there's a lot of talk about Medicare plans that give back or offer funds or allowances for various benefits. Can you tell us a little bit more about that type of an option?
Yeah, so plans that give back, those are generally the plans that offer Part B refunds. That basically just reduces your Part B premium, which you'll see either when it gets reduced from your Social Security or your bill. So it will be reduced right off of there. Some allowances might be the dental allowance that you get every year, or maybe the eyewear allowance that you get every year. So those are just some terminologies that are used for those extras in Medicare Advantage plans.
Okay, great. Thank you. We're going to now turn our attention to the trends in 2025. And I'm going to start with you, Taylor. What are you seeing? Now, you are in the Onondaga County Office of Aging, so you see all types of people there who are asking for some help. What trends are you seeing as you're meeting with people preparing for 2025?
Yeah, great question. With as I mentioned earlier, the out-of-pocket cap for the prescription drug coverage has been a huge one for a lot of folks and just a big relief. And with that, those who are experiencing those high drugs, they will also have that option to, so on top of having a $2,000 cap, folks will also have the option to set payment plans within their prescription drug or Medicare Advantage plan that comes with the coverage. So it's voluntary. It's, people have that option to work directly with their plan and help them spread the cost throughout the year. So it doesn't save you money. It doesn't lower your costs. It just can help some folks spread those costs throughout the year.
Okay. Amanda, what are you noticing as you counsel, because you have your private group, so what are you seeing when you're counseling your clients through 2025 and all the changes?
Yeah, I think the word is out that there are a lot of changes. I think people are coming in a little bit more anxious than they have in past years. However, that's why sitting down and talking to an expert is so important. Somebody like Taylor, Janine, myself, a lot of great colleagues out there. We really want to make sure that you know exactly what is changing in your plan, and the cost heading into next year. I'd like to talk for a second about what to expect when you come to a meeting with somebody like us. So
yes, please do. How do we know how we can make it the most of our time with you?
Absolutely. So first of all, anticipate a lot of questions, because if somebody's going to make a recommendation to you, they're going to have to ask you a lot of questions so that they know your specific needs for what doctors and specialists you see, what current prescription medications you're taking, pharmacies you prefer to use. Income information is also important, not just for determining if you have an income related adjustment, higher premium, but
Okay.
also if you might be eligible for cost saving programs for prescriptions and things like that. So bringing a list of all of that stuff to an appointment, your Medicare professional will be very happy if you bring all of that information. And then also, just anything else that's important for you. But being prepared is important.
I just had another follow-up question, but I'll wait. I'll hold on it for the Q&A. And by the way, thank you to our guests. We are getting some great questions that we will have time to get to once we wrap up the main part of this discussion. But first, let me get over to Janine. What trends are you seeing now? And you work for Excellus, so a private provider. So what are you seeing trends-wise as you're helping your clients right now, Janine?
Yeah, so in 2025 in general is just seeing a large amount of disruption in the Medicare space, in the Part D space, in the Medicare Advantage space. This could just mean larger benefit changes than maybe what you've been used to seeing in the past years. But there's also the case of Medicare Advantage plans being eliminated altogether from certain carriers in certain areas. So again, just a big year for review, making sure that what you originally signed up for and those needs that you did sign up for are still going to be there going into 2025 for you.
Like the headline is review,
Yes.
right? Like
yes,
every year,
absolutely.
but especially this year, right?
Yes.
Yeah. Okay. Thanks, Janine. Amanda, do you have some other things to add there? You're seeing these types of changes in the marketplace as you're working with the clients. If they've received cancellations or change letters, what's one to do?
Yeah. So if you're currently in a Medicare Advantage plan or in a Part D plan, you've received one of two documents by this point. You've either received an annual notice of change, which will highlight all of the updates. Any benefit specific thing that's changing from this year to next year will be laid out in that document. That means that your plan is continuing. You could keep it, whether or not you want to, be based on the conversation that you have with somebody like us. You may have also received a letter letting you know that your plan is canceling. That's a plan cancellation or change. If you receive that letter, that means if you do nothing at all, I don't want to be scary, but come January 1st, you will just have original Medicare A and B. So the drug component will be gone, and all the other things that maybe you enjoyed about dental vision, things like that. So if you received an annual notice of change, review it. If you received a letter letting you know that your plan's canceling, connect with someone as soon as you can.
That makes sense.
Yeah.
If you get one of those letters, start
It's
asking
scary.
questions. Yeah, but it's not the end of the world. We can get it all figured out.
There's still a lot of wonderful options, and after you've had your meeting, you'll feel a lot better than you did before you went into it. So
yeah. I'm thinking about cost saving tips as it's the annual election period, the enrollment time. Are there ways to make it more cost effective? Who wants to grab that? Amanda, you're on screen. Why don't you go for that? Do you have any cost saving tips?
So I think cost saving opportunities really fall more under the Part D side, prescription. The copays are your copays for most things. I would say explore hospital patient assistance programs, maybe if you have a big hospital bill. But typically it's on the Part D side. So things like the New York State EPIC program here in New York that has income thresholds, 100,000 for married couples, 75 for individuals. That program really is designed to help Medicare beneficiaries save money on their prescription copays. I also have had a good amount of success helping clients find help for expensive medications through the drug manufacturer patient assistance programs. So never think that just because someone says one specific thing that means it's it. There might be avenues we can explore.
Okay, great. And I know we're going to get into some more cost saving tips with you, Taylor, in just a minute. A couple questions before we get to that. We really thank you all experts for getting us over the hump here and clarifying what's happening and why it's happening. We do have some great questions from our guests. I'm going to start with the first one and send it over to you, Janine. It's dental is very important to me. How do I ensure that I have dental coverage?
So that's a great question because dental coverage does not come with original Medicare.
Okay.
So you will either want to enroll in a Medicare Advantage plan that includes dental, or you can pick dental up on a standalone basis if you have a plan that does not include dental. So there are options for that additional dental coverage.
Okay, good to know. Thank you. Thank you. And back to you, Amanda. I know can my spouse and I have the same plan? I know that before Medicare, we were getting work coverage and you would get a family plan or a couples plan. But Amanda, can you tell me how that works with Medicare?
That is such a good question. That's a big change for people when they enter the Medicare space. Spouses can absolutely have different Medicare coverages.
Okay.
One might have Medicare supplement, one might have Medicare Advantage, and might have different Medicare Advantage plans. So what's nice is we really can compare your specific needs and tailor that specifically to what you need. And I do find, a lot of times spouses do not have the same thing. So don't assume just because it's the best for them that it might be the best for you as well.
Okay. So if your husband is like 2 years older and they already are on a plan, don't just jump into their same plan. You really need to look at what's best for you personally.
It may be the right fit, but it's good to make sure that you've considered everything that's applicable for yourselves. Yes.
All righty. Thanks, Amanda. Thanks, Janine. Taylor, now back to you for these cost saving questions. Is income a factor at all when you're qualifying for Medicare? Could you go into some further detail on that for us, please?
When qualifying for Medicare, qualification is first based off of your work credits and a couple of different factors, your age. So most of us are familiar with turning 65. Medicare Part A is premium free if you have worked 40 quarters or 10 years. And then Medicare Part B, as we touched on, there's a standard premium. It could be higher based on off of the IRMA. And with all of that in mind, there are savings programs that can help folks dependent on their current income, assets. The first one is the Extra Help Program. Extra Help Program is run through the Social Security Administration. Those who are on Medicare collecting Social Security would have recently received letters in the mail from Health and Human Services if they were potentially identified as being qualified for this program. And it helps with out-of-pocket Part D drug costs. They look at your income as well as your resources and assets.
Okay.
The next is the Medicare Savings Program. Medicare Savings Program is run by each individual county Department of Social Services, and this can help folks pay for the Medicare Part B premium. It can help individuals pay for a late enrollment penalty towards Part B if they qualify based off their income. For example, married couples, if their income's below $3,189 for 2024, they'd qualify to have their Part B premium paid for, and then single individuals, $2,355. So again, it can help. Extra Help is with your Part D drug plans, Medicare Savings Programs with your Part B premium. And then as we touched on earlier, there's the EPIC program run through New York State that can help supplement out-of-pocket costs with a generous income threshold, $100,000 for married couples and $75,000 for individuals on an annual basis.
That's a lot of information there. Again, why we all need to talk to an expert about this and make sure that we're, paying for what we need and paying the right price for what we need. Great. Thank you, Taylor. So we do have some other questions from our guests. I'll read this one. Since I will be working past 65, I confirmed with my employer that I can continue on the company health insurance plan. I was told that I still need to enroll in Medicare Part A or I will be penalized. Is that true? And what are your suggestions to navigate this? Who would like that question? Taylor, Janine, Amanda?
I can take that. You do not have to enroll in your Part A as long as your company has over 20 employees. It's suggested that you do because it's not going to hurt anything, but it will be used as a secondary insurance to your group coverage as long as your company has over 20 employees. So you will not be penalized if you don't enroll in your Part A during that time. It does make it an easier transition later down the road when you're enrolling into your Part B if you do enroll at that time, but it is not required to, and you would not face penalties for that.
Maybe I missed this, Janine, but if you could clarify, what if this person is working for a company that has fewer than 20 employees? And
so if the company is working, or if the company they're working for has fewer than 20 employees, then Medicare pays first. So you will want your A and B.
Okay.
in place, and then your group insurance would pick up as a secondary. So it's very important to know that.
So it sounds like this person is getting the proper guidelines that they need to.
Yes.
Yeah. Okay. Wonderful. Okay. Thanks, Janine. Appreciate that. We do have another question from the audience. Thank you so much for joining us today. My prescription coverage is insufficient. Am I able to purchase supplemental insurance for more coverage? Who wants that?
I'll take it.
Okay. Amanda.
So you really can't duplicate Part D coverage. So whatever Part D plan you have, whether it's standalone or through your Medicare Advantage with prescription drug coverage plan, you wouldn't be able to buy something in addition to that. It would create an issue. So that's why it's really important to review your formulary, see if there's a plan that would cover those medicines that are, more expensive than you'd like them to be. At least you might know that there's nothing that would do better, and then we can explore some of the other options like New York State Epic. But duplicating prescription coverage is an explicit no-no.
Okay, we have like a dozen questions and we only have 20 more minutes. So thank you. We're just going to fire through all of these. Really good questions. Thanks for your answer there, Amanda. Number 3, what can we do to prepare for providers dropping participation in mid-year? Is there any way to know if that is a possibility when we enroll? And are Medicare supplemental plans affected when providers leave networks? Taylor, are you okay on that one?
Yeah, so with this question, it is important to, one, know if your provider and your current insurance plan will be working together next year. Unfortunately, in some situations, these the health company and the insurance, they're allowed to have that time to go through that dispute. It is also important to remember that open enrollment is a rather generous amount of time, so you don't have to make a decision today. You can give yourself time to review your options and see what might happen with the dispute. And then just also keep in mind that there are a lot of other good options, and just reviewing with one of us or someone that you're comfortable with to find what will work for you with your current providers, or if you're willing to change providers, asking them what insurances they're working with. So don't be afraid to ask questions, because there are a lot of changes coming, as we've all talked about.
Okay, great. Thanks, Taylor. All right, this next question is about Ozempic, which is the diabetes weight loss drug, if I'm not mistaken. Ozempic was covered in 2023, says this questioner, but denied in 2024. Which Medicare plans would offer coverage? So that's a specific medicine that we said we wouldn't talk about, but I feel like it's a medicine that a lot of people are curious about. So who out there would like to field that question?
I can answer that. So that's a formulary question. Honestly, it really depends on if the company you're enrolling with has that included on their formulary, on whether or not it's going to be covered and at what tier. So we do see that a lot. It's that big GLP-1 group of medicines, and there's, prior authorizations that usually come with those medicines. So again, it is just referencing that formulary again.
So it's really program specific in that formula.
Yes.
Okay.
Yep.
Okay, great. Thank you. Go ahead.
One thing. So Novo Nordisk is the manufacturer of Ozempic. I find their patient assistance program to be quite generous. So if you're having trouble affording it through your plan, you might just want to Google Novo Nordisk and see if there's a way to get it through the manufacturer.
All righty. Thanks, Amanda. Next question. We alluded to this a little bit earlier about veteran coverage, but I think it's worth repeating, of course. As a veteran, our guest asks, how does Medicare enrollment interact or not with VA healthcare and other VA benefits?
I'll take it.
Okay.
Or go ahead, Taylor. Go ahead.
We can both take it. So I'll start with with veterans and Medicare. So a big question that comes through is, I'm a veteran, I use the VA for everything. Should I get Part B as in boy? It's always a really good idea to consider picking up Part B as in boy, because that'll help cover you if you need to go outside of the VA network, or, if you ever needed an ambulance. That's where you would get that bill, is under Part B as in boy. But also just considering, would you ever need to go out of the VA network? In our office here within the county, we also have a veteran service agency, not to divert, but just know that there are other resources for veterans specifically, and all of us here that are able to help.
Right. Amanda, did you have anything to add to that?
Great job.
Okay, great. Our next question, what are the consequences if you do not sign up for Medicare and then you have an ER visit or a hospitalization? What if?
So,
What if?
yeah. So if you don't sign up for Medicare and you're supposed to sign up for Medicare, I mean, it really depends on if you have coverage that, I mean, you can have direct pay coverage or group coverage that might still cover you. But if you don't have any coverage, then you just don't have coverage. You're really not in a good position. Medicare, I know sometimes it seems like you're getting it stuck to you, but
Right.
ultimately it is built to be more affordable as you get older. So it's always a good idea to enroll when you need to enroll to avoid penalties for Part B and Part D. If it's available to you, you should have it. It's better than not having anything, I suppose.
Better than going to the ER without any coverage, I would suspect. Yeah. Thank you. Thanks, Janine. Next one. And again, we have thank you for these questions. These are really good ones. Here's the next one. Are vaccines billed under pharmacy? And if so, can an expert tell me which ones are covered by my plan? I think I know the answer. The formula, Janine.
Yeah, so we actually have a whole pamphlet on what vaccines are covered at no cost, and yes, it is under Part D. So vaccines would be covered under Part D.
All righty. Next question. Thanks, Janine. Straight Medicare versus Medicare Advantage. What are the pros and cons, especially if I'm a healthy senior without meds or any chronic diseases? Okay, yay to you.
Yeah. Yeah.
Who wants that one?
I guess I'll take that one.
Okay, great.
So benefits of Medicare only, I suppose, would be that you can see any Medicare participating provider. It's Medicare's rules. So maybe a little bit more flexible and, throughout the country or whatever. Medicare A and B does not give you any drug coverage. So I wouldn't recommend that somebody, has just Part A and Part B and forgoes drug coverage, because you will incur a late enrollment penalty when you enroll in the future. The other thing about Medicare A and B, believe it or not, there's no cap or max out of pocket for what costs you could accumulate just under original Medicare. So a lot of times, even using a zero premium Medicare Advantage plan is going to give you that max out of pocket cap. It's going to provide drug coverage for you, even if you don't need to use it. It's also going to make things a little bit more predictable. Medicare is deductible for outpatient, and then 20%. I mean, even as nerdy as I am, I don't know what Medicare's allowed rate is for every single Part B service. So there's really no way to know what those visits and services are going to cost, but it's just that 20% coinsurance. So I think Medicare Advantage's pro is it brings some predictability. It gives you that cap, max out of pocket, plus some other additional benefits. Just make sure provider network's good.
Yeah.
Okay.
I think something to add on to that too, because it's a really good explanation and a common question, especially when folks are new to Medicare, is when folks are considering that original Medicare option with A and B, of course, adding on that drug plan, but also just considering if you would need to add on a Medigap supplement, so that way you can add some sort of predictability by knowing what a set premium would be, and then being able to go from there. So those are really good explanation and a very common question.
Mm-hmm.
Taylor, I'm going to stick with you on this next one. I think you can always divert if it doesn't work out, but this one is there a plan that covers 100% of a medical cost?
No.
Yeah.
So it depends. All of this is so individualized, and you hate to say that it depends on the situation, it depends on the plan, but that's truly what it does come down to. Different services, depending on Advantage plan or original Medicare with a Medigap, they can have different copays, and that's why it's so important to talk with someone about your specific situation. And if you have regular testings or whatever it might be, talk with somebody about what options you have that work for your current situation.
Okay, great. Thanks, Taylor. Our next question is an interesting one, I think. It's, will there be tiers of medications, or do you pay full price until you reach that $2,000?
I can take that. I can say
Janine,
that.
you're my medicine girl
yeah,
today.
so there's always going to be tiers of medicine.
Yeah.
And so you're not going to pay that full price. You're going to have a copay. Like you're going to have that initial phase that you had last year, but only till you hit the 2000 mark. And then you'll go right to the catastrophic phase rather than having that middle phase where you had to pay 25% of your drugs. So yes, there will be tiers. There will still be a copay area there. You won't have to pay the max amount of your drugs until you hit 2000.
Is that how my current insurance not in Medicare works? Or it seems like that's kind of how it is. I pay kind of full price or whatever the price is up to a certain deductible, and then the insurance
If you
covers.
have a deductible, you'll pay up to that deductible, and then you should have a copay after that. So that's how that would work. If you did, and most standalone plans do have deductibles. So you may have a deductible, and some Advantage plans do too, depending on what you have. So it's a very different strokes for different folks kind of world out there, and it's yeah.
Okay, thank you. The next question. Oh, go ahead.
I just would add, the $2,000 cap is going to be really helpful for a lot of people. The formulary, I know Janine's mentioned it a few times. If your medicine isn't on your plan's formulary, there's no coverage for that medicine. You'd have to request an exception. It doesn't have a $2,000 cap, so it's a $2,000 cap on medicines which are covered by your plan.
Mm-hmm. Okay. Thanks for that clarification.
Yes, thank you, Amanda. That is very important.
I mean, so if my really important life-saving medicine isn't in my plan, I need to find a new plan? Is that too simplified?
Work with your professional to know what avenues are available, picking a plan that it is covered, or how to work with your physician who prescribes that medicine to ask your plan for coverage.
Yep, because there is an exception process normally to be able to get that covered.
Okay, great, thank you. Next question, Our plan changes rather subject to underwriting, and can the change be not accepted? Who wants
I'll take that one.
Okay.
Unless you want it, Janine, I'll take it. So it depends on what state you live in. So Medicare supplement plans, anywhere in the country, you can have the first 6 months you're in Medicare without underwriting questions and guidelines. After that 6-month period, it would depend on the states that the protections that your state grants you. So good news for us in New York State, you can move from a Medicare Advantage plan to a Medicare supplement plan without having to go through underwriting questions. You'll see that the rates in New York State are a little bit higher because of that generous coverage guideline. But no, you're not going to have trouble moving from one Medicare Advantage plan to another because of a pre-existing condition. Medicare is much more generous about that than other insurances. And someone add if I forgot anything, because I know that's an important question.
Yeah, I think the only other thing, sometimes folks will follow up with what is that called? What is that law called, or that policy, just so they can have it for their records. And it's referred to as your guaranteed issue rights. So again, sometimes people just like to have that down in their notes, just in case it ever, comes back full circle for them.
Great.
Thank you. The next question is kind of feeds off of that. Medicare Advantage plans often seem too good to be true. Can you explain why and when not to opt into one of these plans, or whether?
I'll take that one, or start off with that. So if you are somebody who has high medical bills, folks will be referred to me who are on chemotherapy, are kidney dialysis. If you have a lot of medical costs, a lot of specialists, you might not want to, look at those Advantage plans. While some of those benefits can look very enticing, I always tell folks, don't pick a plan just because it has dental. A lot of times dental offices aren't really even accepting insurances. So pick a plan that works best for you, and how to do that is walking through your whole situation. And as we mentioned, we ask a lot of questions, and sometimes it tests your patience because we ask so many, but it really is to get that full picture and figure out, is that Advantage plan going to work for you? Or should you really consider that original Medicare with that Medigap option?
Okay, great. Ladies, we have a couple more questions, maybe 2 or 3 left in the time allowed. So I think this is going to work out well from that situation. This next question is interesting too. If you are on Social Security and are automatically enrolled, as we mentioned at the beginning of the hour, Do you still need to meet with a representative? Is this for regular retirement Social Security or only disability Social Security? Good question. Who wants that?
Oh,
Go ahead.
yep. So it's always important to meet with an expert, because having just original Medicare, as we talked about before, is really not enough. You want to make sure you have drug coverage, because you will be penalized if you don't pick that up. But also to know how to cover those gaps of original Medicare, what's going to best work for you. So working with an expert is always important. So Social Security disability, you still have to be on that. I believe, Taylor, correct me if I'm wrong, for 24 months before, if you're under 65, before you would qualify to be on Medicare. With being on that, they'll notify you when you become qualified for Medicare on Social Security disability.
Okay. Anything else to add, ladies?
I would add that the Medicare enrollment is just the A and B piece. If you do have Medicaid or extra health, they'll auto enroll you in Part D, but it is just the A and B piece. So to get the other coverages that we've been discussing, that's never going to be automatic. You do have to take steps to do that.
Okay. If you sign up for a plan this year, can you sign up for a different plan for next year? Because we've talked about so much. So.
Absolutely.
Yeah. Yep, you can change it. So in this annual election period is when you just switcheroo, correct?
Correct.
Okay. And then I have a question that I was thinking about earlier before we say our goodbyes. If you're traveling, and a lot of people in the 65 and above age range might have two homes, and they're in New York half the year and maybe in another warmer state the other half of the year, is there something that they should be worried about or concerned about or looking out for in the Medicare plan that would accommodate coverage in both states?
So, sorry.
No, it's okay.
For emergency and urgent care, on a Medicare Advantage plan, that's going to be covered no matter where you are. And then PPOs will cover you at an out-of-network cost if you're in a place that is not in network. So you will have a higher cost share, but it will be covered. So those are things you want to consider when choosing a plan. On how much do you travel? Where do you go? Is there in-network services if you go to another state? So a lot of questions to ask your expert, when you're sitting down with them.
I would take that into consideration every time. So if I'm sitting with someone who spends half the year in Tampa and I'm going to recommend a plan, I can say, are you seeing specific doctors while you're there? Our provider search tools give us the option to change zip code, look up those doctors, see if they're in. I had a lovely lady this morning who goes to the Cleveland Clinic. So I was able to actually pull up her doctor there to say these plans cover them, these ones don't. So yes, we can really specify where you are. But like Janine said, worldwide coverage for emergency and urgent care. So talk to your professional.
Talk to the professional indeed. And I'm going to say that all three of you ladies will be taking, we're going to put your information here, and anyone who's watching right now can reach out to someone of their choice, but also one of these three experts. We are out of time. That's a full hour of wonderful information. And I thank you so much for joining us today. And whoops, there we go, the thank you slide. Thanks to our panelists once again, Janine Myers, Amanda McLaughlin, and Taylor Frawley. And please feel free to reach out to any of them for further guidance. You see their information, their emails right there on screen. Please reach out. They will continue answering all these questions for you that we've run out of time on, but we thank you for those questions. A big special thank you to our sponsors for this Guide to Medicare webinar. We appreciate you so much, Excellus BlueCross BlueShield. Lots of good information shared today, and a reminder, all attendees will have access to the recording of this webinar, so you can review it, you can see these slides, take notes, reference it when you get your head in the game and you're actually choosing your plan for the next year. So be on the lookout for the link in the thank you email that you're going to receive. You can also look to the Excellus BlueCross BlueShield website for more information and a copy of this, and to syracuse.com also in the coming days. They'll have all the information about this webinar that you can reference as well. So thanks again to all of our panelists and to all of our guests today. This Guide to Medicare webinar was presented again by Excellus BlueCross BlueShield. Great information, ladies. Really appreciate it. And thanks to all of you for joining us. Have a healthy afternoon. Bye-bye.
Thank you. Bye.
Thank you.